Hi, I'm Karine Alejandria from the University of Santo Tomas, and I've entitled this presentation as Pandemic in the Margins, Situating COVID-19 Responses in the Everyday Lives of Urban Informal Settlers in Manila. My aim is to provide a nuanced account of this pandemic through the narratives of my collaborators in Manila's biggest informal settlement, which actually is also a field site of Professor Rosales. This place is called Vesaka Compound. Vesaka Compound is in Manila, in the city of Manila. It is about 52 hectares of reclaimed land, and it has about 60,000 people in it. It's a fluid population, so sometimes it's about 70,000, sometimes it's 50,000. It is also an estuarial community, primarily because of this geographic location, which is in between two bodies of water. We have Manila Bay and Pasig River. Now, for this particular presentation, my lecture will be focusing on 4 key parameters implemented or espoused by the government to battle COVID-19. And these are enhanced community quarantine, social distancing, washing of hands, and balanced nutrition. My argument is that despite the efficiency of these recommendations, their applicability is highly challenged by the everyday realities of those who have been marginalized by our system. Let me go to the first one, which is the enhanced community quarantine, which was officially announced on March 16, and it has put the entirety of Luzon under a strict quarantine condition, such that travel is limited and non-essential industries were closed. The meaning of ECQ for most of us include probably having a webinar like this, going online classes, or working from home. But in the outskirts of our society, we have a different story to tell. For example, what is the meaning of community quarantine in Vesaka Compound? First meaning is that of disrupted informal economy. Majority of the residents of Vesaka Compound are highly reliant on informal economies such as peeling of garlic cloves, sari-sari store, construction work, and even scavenging. With the implementation of the quarantine, majority of these workers have lost their jobs, and this also mean that the households who have been highly food insecure are in a higher or in far more intense level of food insecurity. In my previous works and publications on Vesaka Compound and food insecurity, I've come to understand that food insecurity is much more severe in experience among women and that of older adults. This is primarily because the role of providing, the role of giving way is assigned or sometimes taken on by these groups of people. And so with this quarantine going on, the limited food source that is received by the family through donations or whatever process are mostly given to preferred members of the family, such as children and in some cases men. Now let me go to the second recommendation, which is social and physical distancing. This was a memorandum that was released on March 13, and it requires people to maintain significant distance, again, from each other to avoid catching the disease. Now, this particular policy is, I think, the efficiency of its applicability is quite class-based, primarily because of the fact that in some places like Vesaka Compound, space is a precious is a value that is not shared in the same way that we do. Most of the time, houses are about just 10 to 20 square meters, and houses are really closely, almost attached to one another. And the space here is used in multiple contexts as sleeping area, cooking area, living area, and whatnot. And most of the time, there are about 5 to 7 members using this. There are no spaces for isolation in houses in Vesaka. So physical distancing within the house and even outside of the house is a big challenge for communities like this. Next is that of the policy on wash your hands. We have seen a lot of this campaigns on this, washing of hands, commercials and whatnot. But is it really that easy to wash hands? In Vesaka Compound, it's not. Primarily because number one, there's a lack of potable water source. And because of this, water is very costly in Vesaka. And given that a lot of residents lost their jobs, water usage that is very costly is now being delegated only for essential use, such as cooking food or for drinking. There's also the issue of water disruption, allocation disruption by Manila. And so most of them cannot even comply to this concept of wash your hands. The community members that I work with there just recently got their faucet before the quarantine. So it's a bit of a good story for them. But how about those who don't have access to it? Lastly, there is the recommendation to have balanced nutrition. And balanced nutrition means that we eat good food. Without a job and with donations coming in, this is becoming an increasingly difficult scenario for most of them. Primarily because apart from their incapacity to purchase food due to the suspended work, majority are reliant on the food packages that are being donated, such as what you're seeing in the photo. And the problem is that there is a repetition of this, like sardines, coming from organizations. It's just sardines all the time, mostly. So what did my collaborators did? Some of them have decided to go diving in Manila Bay to collect crabs and shellfishes to augment the type of food that they can serve their family. And for most of you, you might say this is what we call as Filipino Resilience. And most of the time we would say that, look at that's a classic example of how we should be responding to this. But the problem is, what I want to do is for us to rethink this concept of resilience. Are they really resilient? Because if you look into the picture here, they're smiling, they look like they're happy, they got crabs for lunch and whatnot. The problem here is that they got it from Manila Bay. And the toxicity of the water in Manila Bay is very high. That being said, in our own daily lives, we would not even dare to go swim in Manila Bay to collect food, and much more to serve it to our family. So are they really resilient? Is this really a story of are they really lucky? Because I've heard that phrase used most of the time. How about communities that are landlocked? For example, places like Bagong Silang, Payatas, Happy Land, those other urban poor informal communities. Where are they going to get their food sources? That being said, I'd like to point out two parts to conclude this lecture. I'd like to highlight the role of anthropology during this pandemic. The first one is that of the value of engaged anthropology. I think at this time, we social scientists, anthropologists are in a very advantageous position to use their knowledge about communities, knowledge about society, to bring it to the public. And with that, to have policies and actions that could actually alleviate the suffering of the communities that they have been working with. On March 21, having learned of the high levels of food insecurity in Vesaka from my community partners, I called for a fund drive. And sometime that week, we were able to deliver, through the help of Edlyn Martinez and her father, Edwin Martinez, who were able to deliver food package for 40 families that are very vulnerable to food insecurity. This is also seen in other accounts of anthropologists who are also trying to help their communities. The last point I'd like to raise is that of collaborative scholarship through social media. At this point that we can't do field work, we cannot stop and learning about the communities that we're working with, and it's quite fortunate that we have social media, and some of our community partners are in social media. For example, one of my collaborators, Hueng Buhol, is actively engaged in informing me of what's going on with them, how are they coping with the pandemic, what do they need, and such. And I think this is a way for us to rethink our ways of doing anthropology at this time. So to conclude, some of the points I'd like to raise is that pandemic experiences are nuanced by age, gender, and space. Public health policies must be revisited to include vulnerable populations living in the margins of society. And lastly, anthropology has a key role in providing localized context to public health policies. Thank you.